Hello, and welcome to another episode of Leading Health with Dr. Atten. So, today, guys, we are going to be doing something slightly different. Um, a few weeks ago, I was out in Tanzania doing my research, and I bumped into one of my friends, colleague actually. We go back years, and basically, she runs her own healthcare clinic in Tanzania. And I said to her, let me come and do a little tour with you. And she was like, oh, let's do it. Let's do it. So I thought, why not? Let's get it done. So basically what happened was she picked me up from my place, which isn't actually that far from where her dialysis clinic is. And we went there and, it went down. So, guys, today what we want to do is to take you on a tour of the center, show you all of the equipment within the organization, and just to sort of review it and to see how a sort of top quality healthcare institution in Tanzania is actually run. So, guys, today we are talking about Baraka Dialysis. So this is one of the sort of top dialysis clinics in Tanzania, and basically what we're going to be doing is just going on a tour and seeing all of the stuff that goes on within that dialysis center. So, guys, so the location of this center is actually very strategic. It's on the main road. It's in one of the sort of high-end parts of the city. So that means that when you're getting there, it's actually quite convenient because what you've got is you've got a massive mall and you've got lots of other healthcare organizations within one place.
This is our clinic, Baraka Dialysis Centre. And if you look at the whole building, it's a medical building. Above us is the hospital.
Wow.
Below us is the MRI CT diagnostic center. So each institute complements each other because there are services that we have that they don't have, that they have that we don't have.
Amazing. So it's a little bit like a sort of one-stop shop, which I thought it was actually really, really cool. Another thing about the tour, so from the video, was I was really surprised at just how big the facility was. I thought that was really cool as well, and also how well organized everything was. I wasn't really expecting that, but it was something that actually stood out to me just because I've been to loads of private healthcare institutions, and they're not always like. Another thing that really stood out to me was the amount of equipment in that facility. Yes, private healthcare tends to have more capital pumped into it. But what I've realized is when you know you've got a good organization is when you realize that they've gone slightly beyond in terms of the amount of equipment that they've sort of rammed into the institution. So, you can have like a minimum threshold of what you need to actually deliver, but they weren't at the minimum. They were, I, I think, closer to the maximum. And that's always a good sign. So whenever you're sort of out and about looking for a good healthcare organization, look around. Do they have everything? Does it look like they're fully equipped? This center certainly was. So another thing that stood out to me was when we were sort of walking around, we randomly bumped into loads of staff. They're not all on the video, but you can see some of them. And what was really interesting is that they all knew their jobs. Like if you stop someone to like ask, hey, what do you do? What's going on? Like they can give you some really in-depth insight into their role, how their role fits into all of the other roles within the organization.
Their what the intensity they are going to use, we will use there and we will just dispose it there. So even the person that who is attending there, that they will not just come in here to mix up,
Yeah.
to cross the contaminations there, but they were keeping them separate. The separate staff who is attending their patients there.
Yeah.
And personally, I thought, well, that's really good. That shows that like the organization is investing in their human capital. And sometimes, particularly in developing countries, what you tend to find is that they don't always, invest as much as they ought to in their human capital. So again, that's something that stood out to me. Another thing that I really appreciated was the lab. I didn't actually expect to see a lab physically based inside the building. I thought they would have like outsourced it, but then I started to think about the ethos, like how that organization is run. And one of the things that really struck a chord with me was the fact that like they had departments that they could have outsourced. That must have been really expensive to get all of that equipment there. You know, it might have been cheaper in the short run to just say, oh, there's a lab down the road, let's send all the stuff there. But they didn't. They sort of invested in their whole ecosystem, and certainly I think they'll be sort of reaping the rewards from that moving forward. So that was another thing that I thought was actually really, really cool. So guys, my sort of closing thoughts. So after visiting like Baraka Dialysis Centre in Tanzania and sort of looking around and sort of gauging with the staff, I had a few thoughts. One, having enough investment to set up your healthcare facility is very, very important. Investment in terms of good quality equipment and investment in terms of actually having the sort of staff that you need to get things done. And sometimes what tends to happen is that like we invest in some things, but not everything. And, you know, what I realized from Baraka was you need to have that investment across the board and you need to be consistently updating what you're doing because that's a mark of excellence. So guys, the second thing that I picked up from that tour was when you're trying to run a big, good quality healthcare institution, don't cut corners. Sometimes it can be like really, really tempting to think, okay, then we might not need all of that equipment. Let's see what we can cut down on. But over the long run, you realize it doesn't actually pay off. And one of the things I picked up personally from this tour was their sort of long-term mindset. I think that's really, really key, guys. If you have a long-term mindset within the healthcare ecosystem, you're certainly going to succeed. The other thing that I picked up was the location. I think having a healthcare institution in a location that you know is going to be convenient for your potential patients, again, very, very important. Baraka was based like in a really good area. It was off the main road. Perfect, perfect location. And the final thing is think like a patient. Now, this sounds really simple, but what I realized they were doing was they were constantly going through the process of thinking, okay, if a patient comes, where would they go? What would they want? How are they going to feel? And I think that really gives you an insight that allows you to like overcome challenges that, you know, they might not even know they have yet, right? So you can almost predict when you think like a patient, some of the sort of bottlenecks, some of the things that, you know, might make that patient flow, that patient journey a little easier. And one thing I noticed and sort of learnt personally from that tour was when you do that, actually you start to implement strategies that perhaps your competitors haven't actually thought about. So guys, those are the things that I picked up from the tour that we did a few weeks ago. I hope it's been helpful. Leave your comments, leave any suggestions, and I'll get back to you. So guys, stay tuned for more episodes of Leading Health with Dr. Atom.